More than 1 week after the government announced that it had resolved a standoff that has left the country staring at a crisis over the supply of the antiretroviral drugs, most public health facilities in the country are yet to receive fresh consignments of the commodities. People living with HIV are now concerned that the supply standoff may water down gains made in containing the disease. Okukusa spoke to patients and industry players for this special report.
We got to Eric Okioma's office in Nyalenda Estate right on time to catch him on a Zoom meeting with stakeholders and partners discussing HIV/AIDS related issues. Key amongst them, the antiretroviral drugs stockout.
It's difficult for us to say when this whole issue can come to an end, but even as we are waiting patiently, hoping in the hope that this will be resolved as sooner than later. So
the man speaking is Douglas Onyancha, the head of USAID KEMSA Medical Commodities Program. Okioma is among some 1.2 million Kenyans whose supply of antiretrovirals has been affected by a tug of war between the government of Kenya and that of the United States of America over a consignment clearance standoff at the port of Mombasa.
There's anxiety, there's anguish, and you know that some of these medicines we are given at the facility. So we just imagining a situation where we don't have and we have to buy. And those are some of the things that are making us anxious, and it's a hopeless situation.
Commodities being held at the port of Mombasa include HIV testing kits, treatment and prevention drugs, laboratory reagents, as well as TB diagnostic and prevention medications.
Not having the items, the commodities, the ARVs and the laboratory, kits and that kind of stuff is too expensive. It's too expensive in terms of increased morbidity, increased sickness, increased transmission, and also resistance. Those implications of having missing medications or not testing, for example, pregnant women or HIV exposed children is too dire to think about.
Children and unborn babies may suffer most as a result of the 90 million tax standoff. Among the missing supplies is a critical sweet tablet medication for minors.
We also have even mothers who are actually taking adult medication, splitting it into two and crushing. And you see that kind of medicine, that it's bitter, the child cannot take. And one of the stories she was sharing, the child now decided to hide the medicine because the child could not take it anymore.
Data from the National AIDS Control Council says more than 106,000 Kenyan children aged 15 and below are living with HIV, but only 72,968 are on treatment. That number could rise exponentially. In Kisumu, the ARV drugs shortage has hit public hospitals, greatly affecting people living with HIV. Some are now forced to grapple with reduced doses.
We are giving shorter durations, initially 3 months, 2 months. The latest that I've been told today is that they are giving even as short as 2 weeks, because we are hoping that in the meantime we'll have adequate stock for all the facilities.
At the Jaramogi Oginga Odinga Teaching and Referral Hospital, where some 6,784 patients are on care, the shelves are quickly running empty. Staff in charge of the support center tell NTV that the last time a consignment was delivered here was way back in March 2018, and it was short of what they had ordered. Health Cabinet Secretary Mutahi Kagwe assured Kenyans earlier this month that the stalemate had been resolved and the essential drugs cleared for distribution. Kagwe further said that the ministry had received some supplies from other pipeline sources and was restocking facilities around the country to ensure continuity of supply to patients. But for Eric and many more, the sooner the better.
The government
if it has issues with the USAID or with whoever is supplying or the supply chain, they should just take the medication and they sort out those kind of things somewhere. Because this is
Huko Kusa NTV, Kisumu.
which people have to take every day.